An inquiry has heard that patients from Wales who were infected with hepatitis C and HIV from contaminated blood products were the wholly innocent victims of catastrophic failures. The Infected Blood Inquiry is looking at the cases of thousands of NHS patients during the 1970s and 1980s in what's been dubbed the worst ever NHS treatment disaster. Paul Heaney is in Westminster for us tonight. Paul.
Some of the people at the heart of this story should be known as victims. That's according to the lawyers representing them who are speaking here today. This is part of a process that was also described as the first and last chance to get to the truth.
Best brother, son, father, husband you could ever wish for.
Lee Sugar grew up in Pontypridd. His sister Sarah told me her brother was treated for haemophilia with blood products contaminated with hepatitis C. He was infected, which led to liver cancer, which killed him, aged 44.
He had a wife, young children. He wanted to be there for them. He wanted to see them get married. Actually, my niece is getting married next year. He's not there for it, you know. So yeah, he didn't want to leave them. He had no option. It would be good to have some answers, you know, even for his daughter, just to know what happened to her dad, why it happened, to make sure nothing ever happens like this again.
In the 1970s and 1980s, Britain was struggling to keep up with demand for new treatments for haemophilia, a condition that means blood doesn't clot properly. Supplies were imported from the USA, but those supplies were made from human blood, which had been bought from donors, which included prison inmates. Some of it carried HIV and hepatitis C. Those representing victims today told the public inquiry they want answers from the American drug companies that made the contaminated blood, from government at all levels. What did it do to make sure things were safe? And even from the NHS and individual doctors who, it was said in there today, sometimes didn't tell patients after they were infected, and if they did, told them to keep quiet about it for their own good.
Thousands of people have died. Thousands of people still suffer from very severe ill health. And tragically, it is likely that in the future, thousands more will discover that they have been infected with hepatitis C and HIV. The victims regard this inquiry as a search for justice. There is a general view amongst the victims that for over 40 years, people in the know have kept their mouths shut, their files closed, and their shredders busy. All they've received was a belated apology from the Prime Minister in 2015. Where is the justice in that?
There's also concern about witnesses who want further legal help. Lawyers say a 3-week deadline to obtain medical records and give written evidence is too short.
It's not helpful to impose very tight time limits. These people are under a great deal of stress anyway. We want to get on with this. It's got to be done quickly, but arbitrary time limits do not help the process in our view.
Nigel Miller from Kidwelly was also given blood contaminated with hepatitis C. It left him exhausted and depressed years later.
I want to know who knew that that blood was contaminated, and I just want the truth to come out.
Hundreds are determined to have their story heard, but it is feared that others have not or will not live long enough to see this inquiry's conclusion. There is a remarkable number of people who could be called to give evidence as part of this inquiry. Politicians past and present, civil servants past and present, medical professionals, business people. The list seems endless. A conservative estimate as to how long all this might take is around 2 years. Nick.
Paul Heaney at Westminster, thank you very much.